Welcome back now to the latest on coronavirus and new information about a recommended fourth vaccine dose for some people and new cases trending down. We are joined live by Dr. Jeff Pothof from UW Health. Thank you so much for being here, doctor. The CDC is now telling some people who are immunocompromised that they need that fourth dose just 3 months after their third. What do people need to know about this?
Yeah, we've known this throughout the pandemic with the advent of the vaccines that those who are very immunocompromised generate that immune response when they get vaccinated, unlike most of the population. And that leaves them at risk for severe COVID, even though they've been immunized. That's something that we've seen even with Omicron. Those folks who are immunized, boosted, but severely immunocompromised end up in the hospital. If we give them boosters at a more frequent interval, they do get this little spike. It just doesn't last as long. So it makes sense that for those who are severely immunocompromised, they'll get boosters at a much higher frequency than, say, any of us in the general population.
And, we're hearing about the potential for a vaccine for children under 5 coming soon. When do you think parents can expect to do that?
I think for the Pfizer vaccine, it's likely that the FDA will approve the 2-dose series. Now, we know that 2-dose series doesn't generate as much immunity as we'd like, but they're currently studying a third dose. So I think what you'll see is in the next couple of weeks, 2 doses approved with the idea that third dose will be approved shortly thereafter. It'll be a 3-dose series for the Pfizer vaccine. Moderna is set to have data in March. So these might come together pretty quickly to be able to immunize those who are aged 6 months to 5 years.
And doctor, we want to show you this new trending cases right here. It's trending down for the past few weeks in Wisconsin, that huge spike with Omicron you can see, and now it's going down. The state says our 7-day average is the lowest since early January, so about 3,600 a day. What are you seeing in the hospitals? Do you expect the downward trend to continue?
I am optimistic. I do think the downward trend can continue. Certainly, I want to caution folks to not, jump the gun and throw away all of our mitigation efforts too quickly. But this is a favorable trend. In the hospitals, we are having some hospitals who are just seeing less COVID patients. Other hospitals, ours in particular, we still have high numbers of COVID patients, but it's changing in the sense that they're not necessarily coming in for respiratory compromise, needing to be on a ventilator. They may have mild symptoms or be asymptomatic and are coming in for something else. That still requires us to isolate them, but their lengths of stay in the hospital are typically shorter because they're here for that something else.
Right. Okay, and I want to ask you about mask mandates. Milwaukee set to expire next month. Do you think that anyone should consider extending it?
I think we have to let the data drive these decisions. I know none of us actually want to be wearing masks. It's not something we do for fun. But what we'd want to see is percent positive cases, around 8% or lower. And as far as cases per 100,000 people, we'd want them to be just under 50 or so to feel comfortable that if we take away those mitigation practices, that we wouldn't have such widespread transmission, that our curve down would either slow or worst case scenario start to go up a little bit.
Okay, so we're still a little bit off from stopping all of that. Dr. Jeff Pothof with UW Health, thank you so much for joining us today. We really appreciate it.